Hey everyone, Dr. Luke Peterson here, physical therapist for the Knee Replacement Therapist. In this episode of the Need to Know Show, I'm going to share with you 5 really good and great habits to get into after having knee replacement surgery. So before I jump into that, be sure to hit that subscribe button and turn on the notifications if you aren't already a subscriber so you can catch all of our latest videos related to knee replacement surgery. So after someone comes to physical therapy and we're looking to discharge them after surgery, after therapy and a course of physical therapy, I always get the question of what are some things, what can I do to keep my knee replacement healthy, to keep myself healthy, to maintain the longevity, and just get the most I possibly can out of my knee replacement and my body in general. And these are probably the top 5 recommendations that I would give people. So number 1, above all, is maintain a level of physical activity and exercise. And the next question I always get is, what is the best thing to do? What is the best exercise? The best exercise is the thing that you enjoy doing and the thing that you can do consistently. I can give you a great exercise routine of strengthening and range of motion and aerobics, endurance, and all these awesome things, but if it's overwhelming and you aren't going to be able to do that consistently multiple times a week, then it's not really going to be helpful at all. You're just going to do it maybe a little bit, or maybe not even at all, maybe not even start it, and eventually you'll fall off and not really do any exercise or activity. So find the thing that's enjoyable to you. Maybe that is some form of formal exercise. Maybe that's going to the gym. Maybe that's swimming, cycling, walking. I mean, people, that's one of the best things you can possibly do is just going for regular walks for 15, 20, 30 minutes or so every day. Nice, brisk, moderate intensity walking. But also there's things that are not necessarily what you would think of, like gardening, like hiking, whatever it is that brings you joy, brings you excitement. I'm blanking. Maybe it's playing tennis, doubles tennis, so it's a little less intense. I know people who go back to skiing, people who go back to golf after knee replacement surgery. So find that thing that keeps you active, that you find enjoyable, and that you're going to do consistently and regularly. The next thing I would say is try to eat healthy. A lot of things that we're finding now about health of your joints and arthritis and joint health has to do with biological changes and metabolic changes in your body, rather than just talking about the wear and tear that traditionally is what would be most important. A lot of it is biological things. So eating a healthy diet, eating a diet that's going to be low in anti-inflammatory, it's going to help promote a decrease in inflammation throughout your body, help kind of reduce some of those inflammatory markers, the oxidative stress throughout your body. And what does that mean? Well, keep it simple, fruits and vegetables, whole grains, trying to avoid foods that are high in sugars or high in salts, things that are highly processed. It's a lot of stuff with diet, we try to overcomplicate it, but keep it simple. You know what is healthy: fruits and vegetables, lots of plant-based foods, whole grains. Eat the healthy foods, try to stay away from the foods that are unhealthy, and limit those. Number 3, I would say, is just managing your weight and keeping track of your weight. Now, you don't have to be a string bean, you don't have to be super lean, but just trying to maintain a healthy weight and being aware of it. And that goes back to the first two items, trying to be physically active, eating healthy, and having a healthy diet as well. And just keeping that weight at a healthy range that's going to help decrease those stresses, both physical stresses as well as biological, physiological stresses on your joints and on your knees. Number 4 is stretching. Do some stretching, do some mobility exercises. That can be really great. Help decrease stiffness, help keep you mobile, help keep your knee moving, help keep your legs and body moving in general. People always ask me, do I have to do my physical therapy exercises all the time? Absolutely not. Find a routine that works for you. If it's doing a couple stretches every day, or maybe picking 2 or 3 days a week to do a 15-minute routine of stretching or range of motion exercises, that can be really helpful and really beneficial in the long run, You're going to be able to tolerate things a lot better. You're going to feel better. It can be a great stress reliever just to stretch and move the body. You don't have to do a whole yoga routine, but just doing some gentle stretches and mobility exercises can be really fulfilling both physically and mentally and emotionally. And then I think probably the most important tip and the most important habit is just live your life. You had the knee replacement. A knee replacement, the goal of a knee replacement isn't to get this amazing knee with amazing strength, amazing range of motion. The goal of a knee replacement surgery is to get your life back, to get back to doing the activities that you enjoy, to get back to spending time and socializing and just enjoying your life and enjoying living with minimal pain, with mobility, with function, with the ability to participate in the things that you want to participate in. And so enjoy doing the things you like, enjoy living your life. That's probably the number one habit that I would encourage people to do after having a knee replacement surgery. I hope some of this rings true to you. If you have any additional good habits that you would recommend or any questions or comments, please leave them below. I love and appreciate the likes as that helps spread this video to other viewers. And again, be sure to subscribe if you don't already. Thank you very much for watching.